Welcome to MCQs Master 101. In this video, you'll tackle 50 of the most difficult NGN NCLEX case study questions focused on post-operative pulmonary embolism. Test your clinical judgment, prioritization, and next-generation NCLEX decision-making skills with challenging, real-world scenarios designed to prepare you for exam success. Let's get started. Question 1. A 67-year-old woman is admitted to the surgical unit following an elective total hip arthroplasty completed approximately 18 hours ago. Her medical history includes obesity, BMI 36 kilograms per square meter, hypertension, chronic venous insufficiency, and a previous episode of deep vein thrombosis after abdominal surgery 10 years earlier. Sequential compression devices were removed several hours earlier because the client complained of discomfort, and she has refused to ambulate due to severe incisional pain despite repeated encouragement from nursing staff. During morning assessment, the nurse notes that the client suddenly becomes restless and anxious, reporting, "I feel like I can't catch my breath." Vital signs reveal blood pressure 92/58 mm of mercury, heart rate 126 beats/minute, respiratory rate 32 breaths/minute, oxygen saturation 86% on room air, and temperature 37.1 degrees Celsius 98.8 degrees Fahrenheit. Lung sounds are clear bilaterally, but the client appears pale, diaphoretic, and mildly cyanotic around the lips. Which nursing action should be performed first? A. Notify the surgeon of suspected pulmonary embolism. B. Apply oxygen using a high-flow delivery device while activating the rapid response team. C. Elevate both lower extremities and encourage deep breathing exercises. D. Obtain the client's postoperative hemoglobin level before initiating interventions. Answer. B. Apply oxygen using a high-flow delivery device while activating the rapid response team. Rationale. The client demonstrates classic manifestations of a massive pulmonary embolism with acute hypoxemia and hemodynamic instability. Immediate stabilization of airway and oxygenation while activating emergency assistance takes priority before provider notification or additional diagnostic testing. Question 2. The rapid response team arrives, and the nurse reviews the client's electronic health record. Which assessment findings most strongly support the clinical suspicion of an acute pulmonary embolism? Select all that apply. A. Sudden onset pleuritic chest pain. B. Abrupt tachycardia of 128 beats/minute. C. Bilateral coarse crackles throughout all lung fields. D. Severe dyspnea with clear lung sounds. E. Oxygen saturation decreased from 97% to 86%. F. Productive cough with thick yellow sputum. Answer. A. Sudden onset pleuritic chest pain. B. Abrupt tachycardia of 128 beats/minute. D. Severe dyspnea with clear lung sounds. E. Oxygen saturation decreased from 97% to 86%. Rationale. Pulmonary embolism typically presents with sudden dyspnea, pleuritic chest pain, tachycardia, and hypoxemia, while lung auscultation may remain relatively clear. Crackles and purulent sputum are more consistent with pneumonia or pulmonary edema. Question 3. The provider suspects a pulmonary embolism and orders a stat-CT pulmonary angiogram. Before the client leaves the unit, the nurse reviews recent laboratory values. Serum creatinine is 2.2 milligrams per deciliter, baseline 0.9 milligrams per deciliter. An estimated glomerular filtration rate is significantly reduced. The client reports a previous severe allergic reaction to iodinated contrast media requiring hospitalization. Based on these findings, which diagnostic study would most appropriately confirm pulmonary embolism while minimizing immediate risk? A. CT pulmonary angiography with intravenous contrast. B. Ventilation perfusion, V/Q, scan. C. Chest radiograph. D. Bronchoscopy. Answer. B. Ventilation perfusion, V/Q, scan. Rationale. A V/Q scan is preferred when iodinated contrast is contraindicated because of severe allergy or renal impairment and remains an effective diagnostic study for suspected pulmonary embolism. Question 4. While awaiting diagnostic testing, the client's condition continues to deteriorate. Arterial blood gas analysis reveals pH 7.49, PaO2 30 mm of mercury, PaO2 58 mm of mercury, HCO3 22 milliequivalent/L. The nurse interprets these findings in relation to the client's suspected pulmonary embolism. Which interpretation is most accurate? A. Respiratory acidosis caused by alveolar hypoventilation. B. Respiratory alkalosis caused by hyperventilation secondary to hypoxemia. C. Metabolic acidosis resulting from renal failure. D. Mixed metabolic alkalosis and respiratory acidosis. Answer. B. Respiratory alkalosis caused by hyperventilation secondary to hypoxemia. Rationale. Early pulmonary embolism commonly causes hyperventilation, producing respiratory alkalosis with low PaO2 and significant hypoxemia. Question 5. The CT findings confirm a large pulmonary embolism involving multiple branches of the pulmonary artery. The provider prescribes intravenous, unfractionated heparin. Before initiating therapy, the nurse reviews the client's history and current assessment findings. Which finding requires the nurse to clarify the prescription before administering heparin? A. Platelet count of 42,000/mm superscript 3. B. Heart rate of 118 beats/minute. C. Oxygen saturation of 89%. D. Respiratory rate of 30 breaths/minute. Answer. A. Platelet count of 42,000/mm superscript 3. Rationale. Severe thrombocytopenia greatly increases bleeding risk and requires clarification before anticoagulation is initiated. Question 6. Several hours after anticoagulation therapy begins, the nurse reassesses the client. Which assessment findings indicate that treatment is improving the client's cardiopulmonary status? Select all that apply. A. Respiratory rate decreases from 32 to 20 breaths/minute. B. Oxygen saturation improves from 86% to 95%. C. Heart rate decreases from 126 to 92 beats/minute. D. Anxiety significantly decreases. E. Blood pressure decreases from 92/58 mm of mercury to 76/40 mm of mercury. F. Urine output improves to greater than 30 milliliters per hour. Answer. A. Respiratory rate decreases from 32 to 20 breaths/minute. B. Oxygen saturation improves from 86% to 95%. C. Heart rate decreases from 126 to 92 beats/minute. D. Anxiety significantly decreases. F. Urine output improves to greater than 30 milliliters per hour. Rationale. Improvement in oxygenation, perfusion, heart rate, respiratory effort, anxiety, and urine output indicates successful treatment. Worsening hypotension suggests deterioration. Question 7. The client suddenly develops uncontrolled bleeding from the intravenous insertion site, large ecchymotic areas over the abdomen, and gross hematuria. Laboratory results reveal an APTT well above the therapeutic range. Which nursing intervention should receive the highest priority? A. Continue the heparin infusion and reassess in 1 hour. B. Stop the heparin infusion and prepare to administer protamine sulfate. C. Increase intravenous fluids. D. Encourage oral fluids. Answer. B. Stop the heparin infusion and prepare to administer protamine sulfate. Rationale. Excessive anticoagulation with active bleeding requires immediate discontinuation of heparin and administration of protamine sulfate. Question 8. The nurse is caring for the client 48 hours after stabilization. Which interventions should be included in the plan of care to reduce the risk of recurrent venous thromboembolism after discharge? Select all that apply. A. Early ambulation. B. Adherence to prescribed anticoagulants. C. Smoking cessation counseling. D. Routine discontinuation of compression stockings. E. Adequate hydration. F. Regular follow-up laboratory monitoring. Answer. A. Early ambulation. B. Adherence to prescribed anticoagulants. C. Smoking cessation counseling. E. Adequate hydration. F. Regular follow-up laboratory monitoring. Rationale. Mobility, anticoagulant adherence, smoking cessation, hydration, and follow-up monitoring reduce recurrence risk. Compression therapy should not be discontinued unless specifically prescribed. Question 9. The nurse identifies that the client is developing an acute postoperative pulmonary embolism. Choose the most likely condition. 2 nursing actions. 2 parameters to monitor. Conditions: pulmonary embolism, acute myocardial infarction, tension pneumothorax, atelectasis. Actions: administer prescribed oxygen, initiate anticoagulation as ordered, encourage prolonged bed rest, restrict fluid intake, delay emergency notification. Parameters: oxygen saturation, blood pressure, stool color, visual acuity, respiratory rate. Answer: condition: pulmonary embolism. Actions: administer prescribed oxygen, initiate anticoagulation as ordered. Parameters: oxygen saturation, respiratory rate. Rationale: oxygen therapy and anticoagulation are essential treatments, while oxygenation and respiratory status are the most critical indicators of response. Question 10. During multidisciplinary rounds, the nurse anticipates discharge teaching. Which client statement indicates the greatest need for additional education regarding anticoagulant therapy following pulmonary embolism? A. I will notify my healthcare provider if I notice blood in my urine. B. I should avoid stopping my anticoagulant medication unless instructed. C. If I miss several doses, I will double the next dose to catch up. D. I will seek emergency care if I develop sudden shortness of breath. Answer: C. If I miss several doses, I will double the next dose to catch up. Rationale: anticoagulant doses should never be doubled after missed doses because doing so significantly increases the risk of life-threatening bleeding. Question 11. The client has remained hospitalized for 72 hours following the diagnosis of a massive postoperative pulmonary embolism and has been transitioned from an intravenous unfractionated heparin infusion to oral anticoagulation therapy. During the morning assessment, the nurse notes that the client suddenly reports worsening shortness of breath while attempting to transfer from the bed to a chair. Vital signs reveal blood pressure 88/54 millimeter of mercury, heart rate 132 beats/minute, respiratory rate 34 breaths/minute, oxygen saturation 84% on 4 liters per minute via nasal cannula, and temperature 37.0 degrees Celsius 98.6 degrees Fahrenheit. Jugular venous distension is present, the client is increasingly confused, and the skin is cool and clammy. The healthcare provider suspects recurrent pulmonary embolism causing acute right ventricular failure. Which nursing intervention should receive the highest priority while awaiting additional provider orders? A. Encourage the client to cough deeply to improve ventilation. B. Increase oxygen delivery using a non-rebreather mask while activating the rapid response team. C. Place the client in a flat supine position to improve venous return. D. Encourage oral fluids to improve circulating blood volume. Answer: B. Increase oxygen delivery using a non-rebreather mask while activating the rapid response team. Rationale: the client demonstrates signs of obstructive shock caused by recurrent pulmonary embolism. Immediate oxygenation and emergency intervention are the highest priorities before additional diagnostic or therapeutic measures. Question 12. The healthcare provider reviews the client's diagnostic studies. Which findings are most consistent with significant right ventricular strain secondary to a large pulmonary embolism? Select all that apply. A. Elevated cardiac troponin level. B. Right ventricular dilation on echocardiography. C. S1Q3T3 pattern on electrocardiogram. D. Left ventricular hypertrophy on echocardiogram. E. Elevated brain natriuretic peptide, BNP. F. Diffuse ST segment elevation in all ECG leads. Answer: A. Elevated cardiac troponin level. B. Right ventricular dilation on echocardiography. C. S1Q3T3 pattern on electrocardiogram. E. Elevated brain natriuretic peptide, BNP. Rationale: massive pulmonary embolism can produce right ventricular strain, resulting in elevated troponin, elevated BNP, right ventricular dilation, and the classic S1Q3T3 ECG pattern. Question 13. Because of persistent hypotension despite anticoagulation therapy, the provider considers systemic thrombolytic therapy. Before administering the prescribed thrombolytic medication, The nurse carefully reviews the client's history. Which finding represents the strongest contraindication to thrombolytic therapy? A. Total hip replacement performed 3 days ago. B. Oxygen saturation of 87%. C. Heart rate of 128 beats/minute. D. Respiratory alkalosis on arterial blood gas analysis. Answer. A. Total hip replacement performed 3 days ago. Rationale. Recent major surgery significantly increases the risk of catastrophic bleeding during thrombolytic therapy and is a major contraindication that requires careful risk-benefit evaluation. Question 14. The client remains in the intensive care unit for continuous monitoring. The nurse reviews the following assessment findings. Which findings require immediate provider notification? Select all that apply. A. New onset hemoptysis. B. Sudden decrease in blood pressure to 78/46 mm of mercury. C. Increasing confusion and agitation. D. Oxygen saturation improving from 88% to 95%. E. Urine output of 12 milliliters during the previous hour. F. Heart rate decreasing from 128 to 92 beats/minute. Answer. A. New onset hemoptysis. B. Sudden decrease in blood pressure to 78/46 mm of mercury. C. Increasing confusion and agitation. E. Urine output of 12 milliliters during the previous hour. Rationale. Hemoptysis, worsening hypotension, altered mental status, and decreased urine output indicate deterioration requiring immediate intervention. Improved oxygen saturation and decreasing heart rate are expected signs of recovery. Question 15. The nurse evaluates arterial blood gas results 6 hours after aggressive treatment. pH 7.40. PaCO2 39 millimeters of mercury. PaO2 92 millimeters of mercury. HCO3 24 milliequivalent/L. How should the nurse interpret these laboratory findings? A. Persistent respiratory failure requiring immediate intubation. B. Significant improvement in pulmonary gas exchange following treatment. C. Worsening metabolic acidosis requiring sodium bicarbonate therapy. D. Development of respiratory acidosis caused by opioid administration. Answer. B. Significant improvement in pulmonary gas exchange following treatment. Rationale. Normalization of arterial blood gases indicates improved ventilation, oxygenation, and resolution of the acute respiratory compromise. Question 16. The client is prescribed long-term anticoagulation before discharge. The nurse provides discharge teaching and evaluates the client's understanding. Which statements indicate correct understanding? Select all that apply. A. I will use an electric razor instead of a blade. B. I should immediately report black, tarry stools. C. I can stop taking my medication whenever I feel better. D. I should inform all healthcare providers that I take anticoagulants. E. I will avoid activities that increase my risk of injury. F. Doubling a missed dose helps maintain therapeutic anticoagulation. Answer. A. I will use an electric razor instead of a blade. B. I should immediately report black, tarry stools. D. I should inform all healthcare providers that I take anticoagulants. E. I will avoid activities that increase my risk of injury. Rationale. Bleeding precautions and medication adherence are essential components of anticoagulant therapy. Missed doses should never be doubled, and therapy should not be stopped without provider guidance. Question 17. The nurse reviews assessment findings obtained during the client's recovery. For each finding, identify whether it is most consistent with clinical improvement or most consistent with clinical deterioration. Answer. Clinical improvement. Oxygen saturation increases to 96%. Heart rate decreases to 88 beats/minute. Respiratory rate decreases to 20 breaths/minute. Clinical deterioration. Blood pressure decreases to 74/42 millimeter of mercury. Increasing restlessness. New cyanosis around the lips. Rationale. Improving oxygenation and normalization of vital signs indicate recovery, whereas hypotension, cyanosis, and altered mental status indicate worsening cardiopulmonary function. Question 18. The nurse recognizes that the client is developing obstructive shock secondary to a recurrent pulmonary embolism. Select the most likely condition. 2 priority nursing actions. 2 assessment parameters to monitor. Conditions: obstructive shock due to pulmonary embolism, septic shock, cardiogenic shock from myocardial infarction, hypovolemic shock. Actions: administer high-concentration oxygen, prepare for vasopressor support as prescribed, delay provider notification until laboratory results return, encourage ambulation, remove supplemental oxygen. Parameters: mean arterial pressure, MAP, oxygen saturation, skin turgor, visual acuity, hearing acuity. Answer: condition: obstructive shock due to pulmonary embolism. Actions: administer high-concentration oxygen, prepare for vasopressor support as prescribed. Parameters: mean arterial pressure, MAP, oxygen saturation. Rationale: massive pulmonary embolism may lead to obstructive shock requiring aggressive oxygen therapy, hemodynamic support, and close monitoring of perfusion and oxygenation. Question 19. The nurse reviews all medications currently prescribed for the client. Which medication would require the greatest concern because of its potential to significantly increase bleeding risk when combined with anticoagulant therapy? A. Aspirin. B. Docusate sodium. C. Pantoprazole. D. Ondansetron. Answer: A. Aspirin. Rationale: aspirin inhibits platelet aggregation and substantially increases the risk of bleeding when administered with anticoagulants. Question 20. On the day of discharge, the nurse emphasizes prevention of future venous thromboembolism. The client asks which lifestyle modifications are most important after recovering from a postoperative pulmonary embolism. Which recommendations should the nurse include? Select all that apply. A. Walk frequently during prolonged travel. B. Stay well hydrated unless fluid restriction is prescribed. C. Stop anticoagulants immediately after symptoms disappear. D. Maintain a healthy body weight. E. Perform prescribed lower extremity exercises. F. Remain on prolonged bed rest whenever possible. Answer: A. Walk frequently during prolonged travel. B. Stay well hydrated unless fluid restriction is prescribed. D. Maintain a healthy body weight. E. Perform prescribed lower extremity exercises. Rationale: regular ambulation, hydration, weight management, and leg exercises reduce venous stasis and lower the risk of recurrent venous thromboembolism. Anticoagulants should only be discontinued under provider direction, and prolonged bed rest increases thromboembolic risk. Question 21. The client has been transferred from the intensive care unit to the progressive care unit on postoperative day 5 after stabilization from a massive pulmonary embolism. During the evening shift, the nurse reviews the client's electronic health record and notes that the client has been receiving continuous anticoagulant therapy without interruption. While assisting the client to the bathroom, the nurse observes that the client suddenly becomes dizzy, reports increasing shortness of breath, and briefly loses consciousness before regaining responsiveness. Upon assessment, the client's blood pressure is 80 to 48 mmHg, heart rate is 136 beats/minute, respiratory rate is 36 breaths/minute. Oxygen saturation is 82% despite receiving 4 liters per minute oxygen via nasal cannula, and the client appears pale, cool, and diaphoretic. Which nursing action should be implemented first? A. Obtain a complete neurological assessment before initiating interventions. B. Assist the client back to bed, administer high-flow oxygen, and activate the rapid response team. C. Encourage the client to continue deep breathing exercises. D. Document the syncopal episode before notifying the healthcare provider. Answer: B. Assist the client back to bed, administer high-flow oxygen, and activate the rapid response team. Rationale: the client demonstrates signs of recurrent hemodynamic instability and severe hypoxemia. Stabilization of airway, breathing, circulation, and rapid emergency response are the highest priorities. Question 22. Following emergency intervention, the healthcare provider suspects another embolic event. The nurse reviews the client's laboratory results. Which laboratory findings would most strongly support ongoing tissue hypoperfusion? Select all that apply. A. Elevated serum lactate level. B. Increasing troponin level. C. Rising serum creatinine. D. Decreasing urine output. E. Elevated hemoglobin level caused by dehydration. F. Increased mixed venous oxygen saturation. Answer: A. Elevated serum lactate level. B. Increasing troponin level. C. Rising serum creatinine. D. Decreasing urine output. Rationale: elevated lactate, myocardial injury, worsening renal function, and reduced urine output are indicators of inadequate tissue perfusion associated with obstructive shock. Question 23. The provider discusses placement of an inferior vena cava (IVC) filter because the client has developed recurrent pulmonary emboli despite anticoagulation therapy. The client asks the nurse why the procedure is necessary. Which response by the nurse is most accurate? A. The filter dissolves existing blood clots within the pulmonary arteries. B. The filter helps prevent large thrombi from traveling from the lower extremities to the lungs. C. The filter permanently eliminates the need for anticoagulant therapy. D. The filter improves oxygen exchange by expanding the pulmonary arteries. Answer: B. The filter helps prevent large thrombi from traveling from the lower extremities to the lungs. Rationale: an IVC filter traps thrombi traveling from the lower extremities, reducing the risk of additional pulmonary emboli. It does not dissolve existing clots or replace anticoagulation in most cases. Question 24. The nurse is monitoring the client after IVC filter placement. Which assessment findings require immediate provider notification? Select all that apply. A. Sudden swelling of both lower extremities. B. Severe back or abdominal pain. C. Active bleeding from the insertion site. D. Stable blood pressure of 124/72 mmHg. E. Sudden loss of distal pedal pulses. F. Oxygen saturation improving to 97%. Answer: A. Sudden swelling of both lower extremities. B. Severe back or abdominal pain. C. Active bleeding from the insertion site. E. Sudden loss of distal pedal pulses. Rationale: these findings may indicate IVC filter complications such as migration, vascular injury, thrombosis, or hemorrhage and require immediate evaluation. Question 25. The nurse receives the following arterial blood gas results. pH 7.31. PaCO2 52 mm of mercury. PaO2 58 mm of mercury. HCO3 25 milliequivalent/L. Which interpretation is most accurate? A. Respiratory alkalosis with adequate oxygenation. B. Acute respiratory acidosis with persistent hypoxemia. C. Metabolic alkalosis caused by excessive bicarbonate. D. Fully compensated metabolic acidosis. Answer: B. Acute respiratory acidosis with persistent hypoxemia. Rationale: the low pH, elevated PaCO2, and decreased PaO2 indicate acute respiratory acidosis with significant hypoxemia, suggesting worsening respiratory failure. Question 26. The nurse is preparing discharge education for the client's spouse regarding signs and symptoms that require immediate emergency evaluation after discharge. Which symptoms should the spouse be instructed to report immediately? Select all that apply. A. Sudden chest pain. B. New shortness of breath. C. Coughing up blood. D. One episode of mild constipation. E. Sudden unilateral leg swelling. F. Loss of consciousness. Answer: A. Sudden chest pain. B. New shortness of breath. C. Coughing up blood. E. Sudden unilateral leg swelling. F. Loss of consciousness. Rationale: these symptoms may indicate recurrent pulmonary embolism or deep vein thrombosis and require immediate emergency evaluation. Question 27. The nurse reviews the client's assessment trends over the previous 6 hours. Which conclusion is most appropriate? A. The client is demonstrating expected postoperative recovery. B. The client is developing progressive cardiopulmonary deterioration requiring immediate intervention. C. The client is adequately responding to anticoagulant therapy. D. The findings indicate only anxiety. Answer: B. The client is developing progressive cardiopulmonary deterioration requiring immediate intervention. Rationale: worsening hypotension, tachycardia, tachypnea, and declining oxygen saturation strongly indicate worsening cardiopulmonary instability. Question 28. Indicate whether each intervention is appropriate or not appropriate for a client with an acute pulmonary embolism. Answer: appropriate. Administer prescribed anticoagulants. Continuously monitor oxygen saturation. Assess for signs of bleeding. Encourage early ambulation after stabilization. Not appropriate. Encourage prolonged bed rest after stabilization. Discontinue oxygen because lung sounds are clear. Rationale: treatment focuses on anticoagulation, oxygenation, bleeding surveillance, and early mobility once stable. Prolonged immobility increases thromboembolic risk. Question 29. The client suddenly develops severe respiratory distress, hypotension, and altered mental status. Select the most likely condition. Massive pulmonary embolism, atelectasis, pulmonary edema, pneumonia. Priority nursing actions. Activate the rapid response team. Administer high-flow oxygen. Encourage ambulation. Restrict oxygen therapy. Delay interventions pending CT results. Parameters to monitor. Oxygen saturation. Blood pressure. Skin color. Hearing acuity. Bowel sounds. Answer: condition: massive pulmonary embolism. Actions: activate the rapid response team. Administer high-flow oxygen. Parameters: oxygen saturation. Blood pressure. Rationale: massive pulmonary embolism is a life-threatening emergency requiring immediate respiratory support and continuous hemodynamic monitoring. Question 30. The nurse evaluates the client's overall readiness for discharge after recovery from a postoperative pulmonary embolism. Which assessment finding provides the strongest evidence that the client is ready for discharge? A. Oxygen saturation remains above 94% on room air. The client ambulates independently, demonstrates correct anticoagulant management, and verbalizes strategies to prevent future venous thromboembolism. B. The client remains on continuous intravenous anticoagulants, but reports feeling less anxious. C. The client requires 6 liters per minute oxygen by face mask, but denies chest pain. D. The client continues to experience dizziness with ambulation, but wishes to return home. Answer: A. Oxygen saturation remains above 94% on room air. The client ambulates independently, demonstrates correct anticoagulant management, and verbalizes strategies to prevent future venous thromboembolism. Rationale: discharge readiness requires stable cardiopulmonary status, safe mobility, understanding of anticoagulant therapy, and knowledge of recurrence prevention. Question 31. On postoperative day 7, the client's condition has improved significantly, and discharge is anticipated within 24 hours. During the morning assessment, the nurse enters the room and finds the client sitting upright in bed, stating, "I suddenly feel lightheaded again, and my chest feels tight." The client's blood pressure is 8650 mmHg, heart rate is 138 beats/minute, respiratory rate is 38 breaths/minute, oxygen saturation is 81% on room air, and the client is visibly anxious with cool, clammy skin. The nurse notes that the client's level of consciousness is beginning to decline, while telemetry demonstrates persistent sinus tachycardia. Which nursing action should the nurse perform first? A. Apply high-concentration oxygen, activate the rapid response team, and remain with the client. B. Obtain a 12-lead electrocardiogram before initiating emergency interventions. C. Notify the healthcare provider after obtaining a complete neurological assessment. D. Encourage slow, deep breathing to reduce anxiety while monitoring the client. Answer: A. Apply high-concentration oxygen, activate the rapid response team, and remain with the client. Rationale: the client exhibits signs of life-threatening cardiopulmonary compromise consistent with recurrent massive pulmonary embolism. Immediate stabilization and activation of emergency resources take priority. Question 32. The healthcare provider orders additional laboratory studies while preparing the client for possible catheter-directed thrombectomy. Which findings indicate worsening right ventricular dysfunction and inadequate tissue perfusion? Select all that apply. A. Serum lactate of 5.2 millimoles per liter. B. Rising BNP level. C. Elevated cardiac troponin. D. Urine output of 15 milliliters per hour. E. Mean arterial pressure of 72 millimeters of mercury. F. Capillary refill less than 2 seconds. Answer: A. Serum lactate of 5.2 millimoles per liter. B. Rising BNP level. C. Elevated cardiac troponin. D. Urine output of 15 milliliters per hour. Rationale: elevated lactate, BNP, troponin, and oliguria indicate worsening right ventricular strain and systemic hypoperfusion. Question 33. Following consultation with the pulmonary embolism response team, catheter-directed thrombectomy is recommended. Before transporting the client to the interventional suite, the nurse identifies several priority interventions. Which interventions are appropriate? Select all that apply. A. Verify informed consent has been obtained. B. Maintain continuous cardiac monitoring. C. Ensure reliable intravenous access. D. Discontinue supplemental oxygen before transport. E. Review coagulation studies. F. Delay transport until the client ambulates independently. Answer: A. Verify informed consent has been obtained. B. Maintain continuous cardiac monitoring. C. Ensure reliable intravenous access. E. Review coagulation studies. Rationale: safe preparation includes consent verification, continuous monitoring, adequate for access, and assessment of coagulation status. Oxygen should be maintained as needed, and transport should not be delayed for ambulation. Question 34. Several hours after thrombectomy, the nurse reassesses the client. Which findings indicate the procedure has been successful? Select all that apply. A. Oxygen saturation improves from 82% to 97%. B. Heart rate decreases from 138 to 88 beats/minute. C. Blood pressure stabilizes at 122/74 mmHg. D. Respiratory rate decreases from 38 to 18 breaths/minute. E. Increasing confusion develops. F. Capillary refill improves to less than 2 seconds. Answer: A. Oxygen saturation improves from 82% to 97%. B. Heart rate decreases from 138 to 88 beats/minute. C. Blood pressure stabilizes at 122/74 mmHg. D. Respiratory rate decreases from 38 to 18 breaths/minute. F. Capillary refill improves to less than 2 seconds. Rationale: improved oxygenation, stable hemodynamics, normalized respiratory effort, and improved peripheral perfusion indicate successful restoration of pulmonary blood flow. Question 35. The client asks why early ambulation is strongly encouraged following orthopedic surgery despite postoperative discomfort. Which explanation by the nurse is most accurate? A. Walking increases arterial blood pressure and prevents postoperative hypotension. B. Early ambulation promotes venous blood flow, decreases venous stasis, and reduces the risk of deep vein thrombosis and pulmonary embolism. C. Walking completely eliminates the need for anticoagulant therapy. D. Ambulation prevents surgical site infection by increasing body temperature. Answer: B. Early ambulation promotes venous blood flow, decreases venous stasis, and reduces the risk of deep vein thrombosis and pulmonary embolism. Rationale: early ambulation improves venous return and decreases venous stasis, significantly reducing the risk of thromboembolic complications. Question 36. The nurse evaluates the client's understanding of anticoagulant safety before discharge. Which client statements indicate a need for further teaching? Select all that apply. A. I will notify my provider if I notice unusual bruising. B. I should take extra doses if I accidentally miss one. C. I should contact my provider before starting herbal supplements. D. I will use a soft bristled toothbrush. E. Minor bleeding is expected, so I will ignore it. F. I should seek medical attention if I develop black stools. Answer: B. I should take extra doses if I accidentally miss one. E. Minor bleeding is expected, so I will ignore it. Rationale: missed anticoagulant doses should not be doubled, and any unusual bleeding should be promptly reported for evaluation. Question 37. The nurse reviews the following assessment data collected during recovery. Which interpretation is most appropriate? A. Progressive cardiopulmonary deterioration. B. Clinical improvement with restoration of adequate perfusion and oxygenation. C. Development of septic shock. D. Medication-induced respiratory depression. Answer. B. Clinical improvement with restoration of adequate perfusion and oxygenation. Rationale: normalization of heart rate, respiratory rate, oxygen saturation, and blood pressure reflects improving cardiopulmonary function and tissue perfusion. Question 38. For each assessment finding, identify whether it is consistent with recovery or consistent with recurrent pulmonary embolism. Answer. Recovery. Oxygen saturation 98% on room air. Independent ambulation without dyspnea. Stable blood pressure. Recurrent pulmonary embolism. Sudden pleuritic chest pain. New onset tachycardia. Increasing anxiety with severe dyspnea. Rationale: stable oxygenation, mobility, and hemodynamics indicate recovery, whereas sudden chest pain, tachycardia, and severe dyspnea are classic findings of recurrent pulmonary embolism. Question 39. The client develops sudden hypotension, severe dyspnea, and oxygen desaturation immediately after ambulating. Select the most likely condition. Recurrent massive pulmonary embolism. Atelectasis. Pulmonary edema. Stable postoperative recovery. Priority nursing actions. Apply high-flow oxygen. Activate the rapid response team. Encourage the client to continue walking. Delay intervention until diagnostic confirmation. Prepare for advanced hemodynamic support. Parameters to monitor. Oxygen saturation. Mean arterial pressure. Peripheral perfusion. Hearing acuity. Bowel sounds. Answer. Condition: recurrent massive pulmonary embolism. Actions: apply high-flow oxygen. Activate the rapid response team. Parameters: oxygen saturation. Mean arterial pressure. Rationale: sudden hypoxemia and hypotension following ambulation suggest recurrent massive pulmonary embolism requiring immediate emergency intervention and close monitoring. Question 40. Before discharge, the nurse evaluates whether the client can safely manage recovery at home. Which finding provides the strongest evidence that discharge teaching has been effective? A. The client correctly explains anticoagulant precautions, identifies symptoms requiring emergency evaluation, demonstrates proper medication adherence, ambulates safely without oxygen desaturation, and verbalizes strategies to prevent future venous thromboembolism. B. The client states that anticoagulants can be discontinued after several symptom-free days. C. The client reports that compression stockings eliminate the need for prescribed medications. D. The client states that follow-up appointments are unnecessary if feeling well. Answer. A. The client correctly explains anticoagulant precautions, identifies symptoms requiring emergency evaluation, demonstrates proper medication adherence, ambulates safely without oxygen desaturation, and verbalizes strategies to prevent future venous thromboembolism. Rationale: safe discharge requires clinical stability, correct medication management, recognition of warning signs, and understanding of long-term prevention strategies. Question 41. The client is scheduled for discharge following successful treatment of a postoperative pulmonary embolism. While the nurse is completing the final discharge assessment, the client suddenly reports sharp right-sided chest pain that worsens with inspiration and states, "This feels just like when I couldn't breathe before." Assessment findings include blood pressure 90/56 mm of mercury, heart rate 134 beats/minute, respiratory rate 36 breaths/minute, oxygen saturation 83% on room air, cool clammy skin, and increasing anxiety. The nurse suspects another embolic event despite ongoing anticoagulation therapy. Which nursing action should the nurse perform first? A. Administer prescribed oxygen, activate the rapid response team, and remain with the client. B. Assist the client back into bed and reassess vital signs in 15 minutes. C. Notify the healthcare provider after obtaining a complete pain assessment. D. Encourage the client to practice pursed lip breathing while awaiting provider evaluation. Answer. A. Administer prescribed oxygen, activate the rapid response team, and remain with the client. Rationale: the client is exhibiting signs of another life-threatening pulmonary embolism with severe hypoxemia and hemodynamic instability. Immediate oxygenation and emergency intervention take priority. Question 42. The healthcare provider orders repeat laboratory testing while preparing for emergency intervention. Which findings are most consistent with worsening obstructive shock? Select all that apply. A. Serum lactate 6.1 millimoles per liter. B. Urine output 10 milliliters per hour. C. Increasing serum creatinine. D. Cool, mottled extremities. E. Oxygen saturation improving to 98%. F. Mean arterial pressure 55 millimeters of mercury. Answer. A. Serum lactate 6.1 millimoles per liter. B. Urine output 10 milliliters per hour. C. Increasing serum creatinine. D. Cool, mottled extremities. F. Mean arterial pressure 55 millimeters of mercury. Rationale: elevated lactate, oliguria, worsening renal function, poor peripheral perfusion, and hypotension indicate severe obstructive shock and inadequate tissue perfusion. Question 43. The charge nurse assigns 4 postoperative clients to the nurse. Which client should the nurse assess first? A. A client 1 day after knee arthroplasty reporting new onset dyspnea, pleuritic chest pain, tachycardia, and oxygen saturation of 88%. B. A client requesting pain medication for an incisional pain score of 7 out of 10. C. A client requesting assistance to the bathroom before physical therapy. D. A client awaiting discharge instructions after an uncomplicated appendectomy. Answer. A. A client 1 day after knee arthroplasty reporting new onset dyspnea, pleuritic chest pain, tachycardia, and oxygen saturation of 88%. Rationale: this client has classic manifestations of an acute pulmonary embolism requiring immediate assessment and intervention. Question 44. The nurse evaluates the effectiveness of the interdisciplinary team's interventions. Which findings demonstrate successful recovery from pulmonary embolism? Select all that apply. A. Oxygen saturation maintained at 97% on room air. B. Ambulates 250 feet without dyspnea. C. Heart rate 82 beats/minute. D. Blood pressure 122/76 mmHg. E. Severe pleuritic chest pain during activity. F. No evidence of bleeding while receiving anticoagulants. Answer. A. Oxygen saturation maintained at 97% on room air. B. Ambulates 250 feet without dyspnea. C. Heart rate 82 beats/minute. D. Blood pressure 122/76 mmHg. F. No evidence of bleeding while receiving anticoagulants. Rationale: stable oxygenation, normal vital signs, improved exercise tolerance, and absence of bleeding indicate effective treatment and recovery. Question 45. The client asks how to reduce the risk of another pulmonary embolism after returning home. Which statement by the nurse is most appropriate? A. Avoid all physical activity for at least 3 months. B. Take your anticoagulant exactly as prescribed, remain physically active, stay hydrated, attend follow-up appointments, and seek immediate medical attention if symptoms of pulmonary embolism or deep vein thrombosis occur. C. Compression stockings replace the need for anticoagulant medication. D. You only need to take precautions during the first week after discharge. Answer. B. Take your anticoagulant exactly as prescribed, remain physically active, stay hydrated, attend follow-up appointments, and seek immediate medical attention if symptoms of pulmonary embolism or deep vein thrombosis occur. Rationale: long-term prevention depends on medication adherence, mobility, hydration, follow-up care, and prompt recognition of recurrent symptoms. Question 46. For each nursing intervention, identify whether it is indicated or contraindicated for a client experiencing an acute pulmonary embolism. Answer. Indicated. Administer prescribed supplemental oxygen. Continuously monitor oxygen saturation. Administer prescribed anticoagulants. Assess frequently for signs of bleeding. Contraindicated. Encourage immediate ambulation during severe dyspnea. Delay emergency response until CT confirmation. Rationale: acute pulmonary embolism requires immediate supportive care and anticoagulation. Delaying treatment or increasing activity during instability may worsen the client's condition. Question 47. The nurse reviews the following clinical data obtained during the previous 8 hours. Which conclusion is most appropriate? A. Progressive improvement in cardiopulmonary function following treatment. B. Worsening obstructive shock. C. Development of acute respiratory distress syndrome. D. Onset of septic shock. Answer: A. Progressive improvement in cardiopulmonary function following treatment. Rationale: the trends demonstrate improving oxygenation, normalization of vital signs, and restoration of adequate tissue perfusion. Question 48. The nurse suspects a recurrent pulmonary embolism. Select the most likely condition. Recurrent pulmonary embolism, acute pulmonary edema, bacterial pneumonia, stable postoperative recovery, priority nursing actions, apply high-flow oxygen, activate the rapid response team, prepare prescribed anticoagulant therapy as ordered, encourage the client to ambulate, delay intervention until laboratory confirmation, parameters to monitor, oxygen saturation, blood pressure, respiratory rate, hearing acuity, bowel sounds. Answer: condition, recurrent pulmonary embolism. Actions: apply high-flow oxygen, activate the rapid response team. Parameters: oxygen saturation, blood pressure. Rationale: immediate oxygenation and emergency response are the priorities. Continuous monitoring of oxygenation and hemodynamic stability is essential. Question 49. The nurse is reinforcing discharge teaching immediately before the client leaves the hospital. Which client statement requires immediate correction? A. I will contact my provider before taking over-the-counter medications. B. If I notice blood in my urine or stool, I will seek medical attention. C. If I forget one anticoagulant dose, I will take 2 tablets the next time. D. I will stay active during long trips by walking every few hours. Answer: C. If I forget one anticoagulant dose, I will take 2 tablets the next time. Rationale: anticoagulant doses should never be doubled because doing so significantly increases the risk of serious bleeding. Question 50. A nurse is completing the final evaluation before discharge for a client recovering from a postoperative pulmonary embolism after total hip arthroplasty. The client is independently ambulatory, maintains an oxygen saturation of 98% on room air, demonstrates correct administration of prescribed anticoagulant therapy, verbalizes bleeding precautions, identifies early warning signs of recurrent deep vein thrombosis and pulmonary embolism, explains the importance of follow-up appointments, and accurately describes lifestyle modifications to reduce future thromboembolic risk. Based on the comprehensive assessment, which conclusion is most appropriate? A. The client has achieved expected outcomes, demonstrates readiness for discharge, and has successfully met the established goals for safe self-management following pulmonary embolism. B. The client should remain hospitalized because anticoagulant therapy always requires inpatient monitoring. C. The client should discontinue anticoagulant therapy once postoperative discomfort completely resolves. D. The client should avoid all physical activity indefinitely to prevent recurrence. Answer: A. The client has achieved expected outcomes, demonstrates readiness for discharge, and has successfully met the established goals for safe self-management following pulmonary embolism. Rationale: the client demonstrates clinical stability, understanding of medication management, recognition of warning signs, and appropriate preventive strategies, indicating readiness for safe discharge and long-term self-management. Great job completing this advanced NGN case study. If you found these questions helpful, like the video, subscribe to MCQs Master 101, and turn on notifications so you never miss our latest NCLEX exam prep content. Keep practicing, stay confident, and remember, every question brings you one step closer to becoming a licensed nurse. Thanks for watching, and see you in the next video.